Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Today we will talk about writing after a long time. We have got a very big letter, so we need to learn how to select the data. Before doing that, please subscribe our channel if you have not to get the best OET sample videos. Again, being Dr. BKM Institutes, to be very honest, we are not the creators of the material, but we are the best when it comes to teaching you how to attempt OET. So talking about the letter of today which we are doing, so today there is a letter that speaks about write a letter to Dr. David Brown, diabetes specialist. Now this is a very specific letter, as if this thing comes in your exam, you would be like heartbroken to have such a big letter, because we are allowed to write only 180 to 200 words. Also, I would like to specify you all that in the recent exams, I have heard couple of people, what they did, basically they erased. Please try to avoid eraser as much as you can, right? As much as possible to avoid the eraser. Don't erase too much because it makes your paper filthy and it does not look nice. You need to have a neat and clean paper. It does not mean that you cannot erase small things. Of course you can when it is required, but try to write very less, very less. And if by chance your word count is less than 180 or around 190, if you want to write one more line, then you can write, please note that patient is having diabetes, whatever according to the letter. Suppose there was a point in which you were confused, so you don't know whether to write it or not, please don't write it. In the last, just write one thing, that please note patient is having this problem, so it is important to take care of this thing. So this saves your data. So first of all, the first intention when you get such a big letter is to avoid writing too much, because it's a very big letter. So the first thing you should notice in your exam is to whom you are writing the letter. So always start the letter from the last page. Write a letter to Dr. David Brown, diabetes specialist. Now this is the main word. Diabetes specialist means you don't have to write everything about the patient. You just have to write only points which are specific to diabetes. Flinders Medical Center, Stewart Road, Bedford Park. Okay, so all these things are important and must be taken care of. Okay, so the thing is that you are writing to the diabetes specialist. So what it means is that you have to consider only diabetes data. So Stewart Road, this thing, Bedford Park 5042. Okay, so now we have got, now this is the last thing, request. Most of the times it is written as discharge plan, but in this case the case notes have mentioned request. So it means only discharge plan, that you have to request to the diabetes specialist what patient needs. So I will take the biggest thing, that is the cross. Even when reading, I use elimination method. Even while writing, when we have too much of a big letter, I take this thing which is this cross. Confirmation of the glucose levels required. So it can be done by diabetes specialist. That means I need this thing. So it is a very important thing. I will put a tick on it. Patient requires education on measuring blood glucose levels at home. That means diabetes specialist can guide the patient about how to measure the glucose levels at home. Important. Diabetes educator may need to be organized for her. We can request diabetes specialist to arrange a diabetes educator. If you don't think that it is not required, so you can yourself arrange diabetes educator. So it is a point again that can be included and that can be. So try to avoid this point till the end. You can write. So these are the points I was talking about. When you are confused, try to write it in the end. Please arrange a diabetes educator for her. Yeah, please note it is important to arrange a diabetes educator as she may need it. So we can write this point later on. So glucose, confirmation of glucose can be done by diabetes specialist. Very important point. Patient requires education. Very important point. May need insulin injections. So only diabetes educator can check whether the patient needs or does not need. So you can request the diabetes specialist that please check whether the patient needs insulin injection or not. Important point. Patient needs information on eating patterns, strong encouragement to improve diet or reduce. Yes, can be included. May require advice from a dietitian. Now, when they have mentioned the word that he may require the advice from the dietitian, so this point will be covered by dietitian. So that is what you need to understand in OET writing, that you it is not very important to write this point, because this letter we will write about the eating pattern to the dietitian. Basically, you get the case notes of the patient and you have to write a specific letter to diabetes specialist. So when it is talking about eating patterns, that can be done by the dietitian. So we don't have to tell it to the diabetes specialist. That is where we can save the data. Means this point can confuse you if by chance you write it. It is not like you will be failed. No. But if you can avoid it, you would be able to save your data. So diabetes specialist will do confirmation, will teach the patient how to measure the glucose levels at home. Teach word. Please teach him. Diabetes educator may be required. Not very important point. Confusing point. We will do it later on. May need insulin injection. So diabetes specialist will decide whether the patient requires insulin injection or not. May require advice from a dietitian. Also needs help to introduce exercise. Diabetes specialist will not do any help to introduce exercises. That would be done by physiotherapist, or maybe by an occupational therapist, or maybe by someone else. Strong encouragement to reduce working hours. Diabetes specialist will never do that. It would be done by the counselor. So that is what you need to understand. Considering these points, all the information, the most important 3 points which I can fetch, this is what data selection is. Data selection, you always say data selection is a very tough thing, sir. Please teach us how to do data selection. That is how easy it is. Dr. David Brown, diabetes specialist. That means he's a specialist, he's a doctor. So he will tell only confirmation, whether we have done it right or wrong, education of measuring at home, insulin injections. These 3 important points. That is how you select. Now this becomes my main point of the patient. Now let us check the whole letter in detail. I will try to go fast about it because otherwise you will get bored. So main thing we have covered. So basically diabetes specialist has to teach the patient, or needs to teach the patient, about measuring glucose level, whether he needs insulin injection or not. And also one more point was there, I need to remember that word, confirmation of the glucose level. That's it. So now you would be able to conserve the data. Let's see how to go about it. Now when you have read the discharge plan, that is the request, when you have read to whom you are writing the letter, now you can understand we are in that complete aura that we just want to write specific points to the diabetic specialist, and now we need to tell about the patient. So note says Highwell's Women's Clinic, 12th January, February, March, April, May, June. 12th June 2013 is the date of today. Name Jane Donne. Date of birth 1976. Now it is 2013. So that means patient is 24 plus 13, 37-year-old. 37-year-old lady having 25 weeks of pregnancy and is suspected with gestational diabetes. Now, this is the main thing. Patient is 25 weeks pregnant, having a possibility of gestational diabetes. That means is suspected with gestational diabetes. That is why she is being referred to you for the confirmation of glucose level, because she is suspected, as well as to teach her how to measure the glucose levels and to check whether she needs insulin injection or not. This is my data selection. So when you don't go deep into the letter, you can easily find the purpose of the letter. Now, if I have to write the first point, I can make it this easy for you guys. I'm starting from here. Please notice it, how to write a simple letter. This letter is being written. First paragraph is all done. Last paragraph is also done now. So first and last paragraph are almost the same. First paragraph is written briefly. That means very less. And the last, you explain the points. Otherwise, first and last paragraph are related to the purpose of the letter. This letter is being written regarding Mrs. Donny, or whatever the name was, second name, Donny. I would not mention the age because I will mention the age here when I would say regarding Mrs. whatever the name, Jenny Donny. Sorry, I forgot the name. So I'm just, using any name. Donny, aged 37. So that is how when I will write it, A can be capital, A can be small. That's not a problem. Smaller is better because we are using after comma. So then we will say, Dear Dr. Brown. All right. So now this letter is being written regarding Mrs. Donny, and age I have mentioned here. So main point, who is 25 weeks pregnant, main point, only main point, and is suspected with, get possibility means suspected with, and is suspected with gestational diabetes. Therefore, she needs your expertise regarding expertise, sorry, spelling. Please always learn spellings. Don't make any spelling mistakes. Sometimes people get 280, sometimes people get 290. That can be basically just because of the spelling mistakes. So please, referred spelling, expertise spelling should never be wrong. Never. Never do small silly mistakes doing spelling wrong of referred or expertise. So she needs your expertise regarding, or expertise to confirm her glucose levels, as well as needs education regarding measuring of glucose levels, regarding how to measure glucose levels. That's it. Don't write everything in the first paragraph. Now see how simple it is. Just look at this, like how simple. 25 weeks pregnant, main point. Suspect, I have not read the whole letter. Even then I know the purpose. When you get into the detail of the letter, that is where you get stuck. Just try to find the main word to whom you are writing the letter. Main purpose, that suspected with gestational diabetes. She is suspected, that is where you will get the maximum point. Therefore, she needs your expertise to confirm. And then you write, as well as she needs education. Sorry, she needs education regarding how to measure glucose levels. That's it. Complete. Now the letter, it is 99% that you will pass. Don't do any grammatical mistake. Don't write everything. You will automatically pass by 350 marks. Don't write anything extra. The simpler you will write, the more marks you will get. Now just read about the lady. First pregnancy, history of weight issues over the last 6 years, giving up regular support, and we don't have to mention about the exercises. Don't write about sports thing. Increasing work hours, diabetes specialist will not teach about work hours. So don't write these extra words. That is where you save data. So write only history of weight issues over the last, no history of diabetes in the family. Now why to write no history of the diabetes in the family? You may write it to tell the doctor that we are confused because patient does not have a history of diabetes. So maybe she is not having it. That is why we are confused. So you may mention this point. So let's do it. Mrs. Donny is 25 weeks pregnant and has been facing weight issues since last 6 months. Further, it is important to note that she does not have any family history of this. So yeah, if you are writing this point, if by chance you miss this point, it will not affect your scores because that is not the main point, but diabetes specialist should know about the family history. So then it becomes main point. But if you by chance forget it, nothing to worry. But if you write it, that's good. So it is important to note that she does not have any. Otherwise, I told you, when you are confused about any point, let's cut. And in the last paragraph, last line, we will write this thing. It is important to note that she does not have any family history of diabetes. Or you can simply say, please note. So that now I have saved 4 words. It is important to note was taking more words. Please note that she does not have any family history of diabetes. So I will write it in the last after means fourth paragraph end. So anything that confuses me, I do not write it in the start because I would not be able to erase. So it's better if anything is confusing you, don't write it, please. Okay. And if I tell you the format of the letter, obviously, dear, Dr. David Brown, Dr. David Brown. I'm just telling you about bit of format when I am writing the whole letter, so why to skip it? David Brown. Then you mention the complete address like Stuart Road, whatever was given, and then you mention the date. Today's date, something 2013 was there. Complete date, whatever was given. We noted June maybe, so 27 June or whatever the date was. So this way you will mention. So this is the complete format. Stuart Road, and whatever the hospital name was given, so you can write everything here and then you do the letter. So this is the complete format. If by chance you write this thing here, then also it will not affect your scores, but date should be the second thing, to whom you are writing should be the first thing. These two things you can exchange. If by chance you write this way, not a problem, so don't worry about this last thing. Better format, again, both are equal, it doesn't affect me, both are equal, so it does not really affect the scores. Okay, so now coming back to the main point, medical history is done first week. So medical history says first visit was on 27th, now it is 27 June, it is 12 June. Okay, so I will change the date as well, 12 June, not to confuse you for anything. When we are doing the work, we should do it nicely. So now simple, first visit 27 June when she was 9 weeks pregnant. How to use tenses? So she visited for the first time and was 9 weeks pregnant. It should be in the was. When she visited for the first time, she was 9 weeks pregnant. Risk of diabetes due to weight issues, weight 90 kg, BMI was itna. Client given advice on nutrition and to change the diet. So if I have to write this thing, if I do not write this line, if I write the line over here, otherwise I can make it even simple. Let's make it more simple. She does not have any favorite. Let's make it this way. Further saving of words, she does not have any family history of diabetes. Okay, she has been facing, sorry. And that is why this is a very important tense, present perfect continuous with usage of since or for. It will give you lot of marks because then examiner will know that you know what is present perfect continuous, has been ing with since and for. So this will give you lot of points. So if you want to know how people score 390, 410 in writing, with this tense, present perfect continuous. When anything is ongoing and you know the time frame, you say has been facing, has been having diabetes. So yeah, this is very important point. That is what fetches you marks. Sometimes people say, oh, it is very simple, sir. I also wrote the same letter. He also wrote the same letter. Then why did he get 450? I got 350. This is because he knows these tenses has been ing. So please put attention on these things. On first visit, or maybe you can say on 27th February, simple, on 27th February. Now you know that you have to save the word. On 27th February, she visited for the first time and was 9 weeks pregnant. And along with that, always use in the past, along with that. So always in the past, you should note along with that. Okay. Just a second. Yeah. Along with that, she was facing weight issues. Always again, was very important, was she was facing weight issues. Or she was, along with that, she was on risk of diabetes due to weight issues. That is better. I have completed one with it. That is how you write. Due to means, that means because of weight issues. Let's check if we have written right. If by chance you feel that this line is too big, this line is too big. So simple, simple. Remove the and put the full stop. That's it. Nothing is complex. When you make it complex, then it becomes complex. Simple. So then she was advised to diet, exercise, and nutrition. If you want to write this point, now I have decreased the line. Now these are connectors for which she was advised regarding nutrition, exercise, and what else? And diet. Diet is involved in nutrition only, but anyhow, if they have given, I will also mention, nothing to worry. That's it. I would like to reduce it even more. I would like to reduce it even more, but I wanted to teach you the connectors. Along with that, if you use the and, otherwise, along with that, she was having this, for which, commas on both sides, for which she was advised. Very easy, very nice. These are the main connectors of OET. Never use furthermore, moreover, never, never. Furthermore, moreover, we don't need it. So for which is a very nice connector. For which means therefore she was advised to. So you can replace the word therefore with for which she was advised. Now let's check out the next date. Second visit, 17th 4th. So she visited on 27th. So that means almost after 1 month and 20 days, 1 month and 20 days, she visited again. Now she is 16 weeks pregnant. Weight gain continued. Weight was 96 kgs, referred to the nutritionist. So her weight was, so now again you can save the data. On her second visit also she was, or second visit also her weight gain continued. So that is what we want to say. So that was the main point, that she is constantly gaining weight. As, now I'm mixing up the point. As means because, as she was having 90 kgs in the first visit and it reached to 96 kgs. That's it, main point. You can mix up the data to avoid the word count, to decrease the word count, and to make it more pleasant. If by chance you write it here, there is nothing wrong. She was on the risk of diabetes as her weight was 90 kgs. You can put it this way as well, for which she was advised. So her weight gain continued and it reached to 96 kgs. Simple, means we are recording everything. You can listen to this line and please notice the comma when you change the subject. So here we change the subject to it. That is why we are putting comma before it. So now see how pleasant it is for the for Dr. Brown to read. How comfortable. 25 weeks pregnant, has been facing weight issues. She does not have family history. On 20, she visited for the first time, was 9 weeks pregnant. Okay. She was risk on diabetes. Okay. As her weight was 90. So Dr. Brown can understand 90 kgs weight, and for which she was advised. Okay. On her second visit, her weight gain continued and it reached to 96 kgs. So she was referred to nutritionist. Then third visit, 12th June. Today is 12th June. So somehow we have reached to today. That is, today weight gain is 13 kgs. Client is too busy. We will not refer this point. Displaying several symptoms of gestation. Now this is the main point. Today, she has visited again and has gained 13 kgs of overall weight and is displaying several of symptoms, main points only. That is why I always say that OET writing can never be difficult if it gets difficult when you overthink. When you do less with the writing, you feel more comfortable. It becomes much easy. Now this is done. She has visited again and has gained 13 kgs of overall weight. If you don't want to write, it does not change anything. 13 kgs of weight, and is displaying, that is the main thing, that she is having several symptoms of gestational diabetes. Blurred vision, feeling thirsty, constant urination. Now you can write couple of symptoms such as blurred vision and feeling thirsty, or maybe frequent urination and etc. Don't write all the symptoms. We just want to tell the doctor that she is having many symptoms of this. Okay. Test taken during the appointment 12 June, GCT, OGTT, and post glucose drink test. So now this is the main thing. I know these tests are very important to be noted, but again, you do not have the word count now. What to do? So you say, therefore, few tests have been conducted. Now this is the main grammar. When you are writing in the present tense, so you have to convert she was advised was plus third form into has been third form. But test is plural, so that is why I said few tests have been conducted, reports of which is being enclosed with the letter. If you don't want to write any this line, again, you can take this line from here, we can put it in the last. Please note, few tests have been conducted and the reports are being, please note. Otherwise, you can write anywhere. You just have to make a good letter. Few tests have been conducted, reports of which is being enclosed with the letter. Or you can say anything that confuses you, make it simple. Don't make complex connectors like and reports are being enclosed. Now, even simple, because you have to write just nicely. So few tests have been conducted and reports are being enclosed with the letter that we can write in the last. Okay. Now nothing to worry. Social background, post pregnancy, this, enjoying TV, living with husband, client is working, finishing. We are not talking about diabetes specialist. We cannot mention all the points. Struggling, agitated due to the possibility was raised after the blood test. Okay. Now I have to write this line on here only, because there is a line that has been given that patient after knowing this thing that there is possibility she became agitated. So I need to tell this to the doctor that she got agitated, and reports are being enclosed with the letter after telling her about possibility of gestational diabetes, she has become little agitated. She has become little agitated. Again, I am not trying to use their language. I am trying to make my language easy, that after knowing this thing, she became little agitated. That's it. And I want to say everything in the present. Reports are being enclosed. This. So I have enclosed the reports and I have told the Dr. Brown that she is little agitated as well. So now the last point, I know I have to write only 3 points. Now, therefore, she is being referred under your expertise. That is total time we have taken to write all this letter and to read this big letter. Total time is only 25 minutes until now. You can understand how easy OET letter is if you do not make it complex. Therefore, she is being referred under your expertise for the confirmation of glucose level and guidance to teach her about measuring of glucose level at home. Nothing to panic, please. If by chance my letter remains short, I will use those important lines later on. But first of all, the first thing is to save the data so that you don't have to erase it. That is the most important thing about OET writing. Now the letter is all done. You are at the last thing, which we did not mention. Huh? It would be greatly appreciated if you can guide her whether she needs insulin injection or not. If you by chance are getting confused about this word, if you can guide whether she needs insulin injection or not, now this becomes even simpler. Letter is done, guys. Even after doing so much of saving of words, still my word count is little more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 10 words if I suspect. 1, 2, 3, 4, 5, 6, 7, 8. So this line has 8. 1, 2, 3, 4, 5, 6, 7, 8, 9. So I will take 9 as an average. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. If I count it, 17, 18, 19, 20, 21. 20 into 9, 20 into 9, 180. So this letter is around 190 words. Perfect. Now this is not counted in the word count. Word count is counted only from here until here. You can make 4 paragraphs. You can make 5. Today I have made 5 paragraphs. It is not a problem. Now see how the letter, now Dr. Brown will read this letter when you will send the letter. How simple. 25 weeks pregnant, suspected with diabetes. Okay. So Dr. Brown understand, okay, she's coming to me for education and with the possibility of gestational diabetes. Then, okay, 25 weeks pregnant or coming 2 times. Okay. Further word count saved, has been facing weight issues, does not have family history of diabetes. On 27th February, she visited for the first time. If by chance you want to make 4 paragraphs, that is how you can make 4 paragraphs. On 27th February, she visited for the first time, for which she was advised. On second visit, it reached to 96. Today, she has visited. Now, it is not important to tell the diabetes specialist that we referred the patient to nutritionist. She did not go, because diabetes specialist doesn't want to know about this thing. He wants to know that what is the weight. Today, she has visited again, has gained 13 kgs of weight. If you want to say further lines, further words, today she has gained 13 kgs of weight, or you can say today she has reported gain of 13 kgs weight. That is how you can save your word count, but that makes your English complex. Again, OET does not need complex language. So if your English is average, don't overdo it. And is displaying several. Now the word count is around 180 to 190. Few tests have been conducted. Even by chance my word counts reach 210 or 220, nothing to worry. Don't erase. 210 is not a problem. And the word count again is from here until here. This is your word count. That's it. And you don't have to count every word. The way I counted, that is the same way you will count as well. So there is nothing to worry at all. You just count those words in the same way. Okay. So now it's all done. And now these words are not counted. Should you require further information, feel free to contact us. Yours sincerely. Even if by chance you write sincerely or faithfully, it does not make a difference. But still, if you want to know, when you know the name of this person, Dr. David Brown, then you write yours sincerely. If name is not given, if the name is not given Dr. Brown, then you say yours faithfully. Then you will write yours faithfully. So that is how you can go about it. Okay. I hope you all have understood this letter, and it's very simple. Yours faithfully. Now simple, registered nurse. That's it. That's your complete letter. Does not take more than 25 minutes. So that is what I would like to tell you guys. Everything, whether it is OET writing, it is OET reading, it is OET listening, it all require your calmness. Nothing is difficult in OET. So even when it comes to reading, there would be few questions which would be complex. Don't do these questions in the start. In the same way, when you are doing OET letter, don't pick any heavy data in the start. Don't pick any heavy data. If there is any data that is confusing you, you can write later on to that data that you can write later on to that data that please note. So don't get confused about anything, because when you are confused, that is where you do grammatical mistakes. Always, you can always see this. Whenever you are trying to overdo thing or you are confused about a thing, you try to select some data which makes you do grammatical mistakes. So you can avoid your grammatical mistake by not doing the confused data. And if your word count is less, say please note patient is having diabetes, or patient is suspected of diabetes, anything like that, or patient has family history of diabetes, or patient does not have family history of diabetes. So that is how you do it. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Please watch this video again. I know it's not tiring, rather I would say it's interesting, but watching again we feel, are again I have understood. No, when you will watch it now, now you will see the connectors. By this time you can realize you are all focused on the data. You are all focused on what to write, what not to write. Now is the time to learn grammar and connectors. When you will listen to this video again now, you would see all the connectors, you would see all the grammar, because now you know how to select data. Now you can focus on grammar and connectors. And this letter is one of the biggest letters, so every connector has been covered. And you can see we don't need too many connectors. This is Dr. Bhupesh from Dr. BKM Institutes. Again, assuring you for the best OET coaching and results you all have got, and I have posted it everywhere. And result is something you give. But one thing I can surely tell you, if you will follow us, there is no chance of failing at all. This is Dr. Bhupesh again from Dr. B Chemistry. Thank you.